Hey people, how are you? It's a beautiful afternoon. It's actually noon 12. It's actually 5 after 12, and this is a beautiful Thursday, and I hope you all are having a beautiful day and enjoying good health and eating good food, eating healthy. So today I'm going to be showing you guys how to accurately check your blood pressure at home. And I know a lot of us, a lot of people think they don't need to check blood pressure because they don't have high blood pressure. No, if you're an adult from 20, I recommend from 20 years or less, from 20 years you should start checking your blood pressure. You should have this. Not that you should start checking it every day. At least even if it's once a week, if you're not hypertensive, you should get one of this. But because believe me, a majority of people are not eating right, and a lot is happening in your blood, in your artery, your blood vessels. Okay, you might not be seeing it. That's why they say high blood pressure is a silent killer. People don't have any symptoms, no headache, no chest pain, no shortness of breath, nothing abnormal, so they feel they're okay. So when you know your numbers, then you begin to work on your lifestyle. Okay, so we have this, which is the one I highly recommend, the digital blood pressure one. This I highly recommend you to have this one, which is the one I use. We have another one, the wrists. I hardly use this, but I take this a lot, especially if there's some patient who are like on the big side, so I'll have to use this around. So one thing about this is no movement, no talking. It can easily go into error. So you put it this way and put it to your head before you press it, and no movement. No movement, no talking. So I don't use this a lot. So as a healthcare professional, I use this. So this I wouldn't recommend to you if you're not a healthcare professional. So this basically for healthcare professionals. So I love using this because I feel this is more accurate. You're able to hear, you're able to listen to the heart as it beats. But this really, the digital is a simple one for those who are not a healthcare professionals, for you to use at home. So this, for my audience, my community here are not healthcare professionals, so I'm gonna take this away and we'll deal with this. Just a quick fun fact about me. When I was in school, I found this very difficult to pronounce. I don't know if any of you can pronounce this. Let's try. I used to say is it phygmomanometer? So phygmomanometer, I don't know how. So this used to be very difficult for me to pronounce in school. Phygmomanometer. And this is the stethoscope to listen to the heart. So this is the cuff. So let's put this aside for a healthcare professional, but for my audience, this is what I recommend you to get. If you're on the maybe big side, or you're not able to get a perfect cuff size, you can take this. But make sure when you're using this, you are at rest, no movement, no talking. It should be here, okay? So quickly, I'm gonna check my blood pressure, and with that, we can interpret with that. So before I do that, quick basic info you should know. When you want to check your blood pressure, make sure you're sitting with your feet resting on the floor, not cross. Relax yourself. And when you put the cuff around your arm, it should be at heart level. And of course, I'm gonna take this off before I check my blood pressure, because you don't need any tight fitting clothes here. You don't need anything tight. It can make the blood pressure high. So you need this place to be free. And sometimes people get anxious. You can ask for permission, take few deep breaths, hold it, blow out through your mouth, relax, and no tensed muscles. All this can make the blood pressure falsely high. So you need to be relaxed, no talking, get a very comfortable position. This is not really comfortable for me. So you can get a very comfortable position, your arm this way, this fingers not crossed, right? Like this. Relax. Your arms are relaxed here, okay? Relax heart level or here. Don't lay your put your body weight on your arm, applying pressure. That can affect the blood pressure reading. Make sure you relax. Get a very comfortable position where you can relax. And if you get anxious, you can just take few moments of deep breaths. So let me go ahead and teach you guys some deep breath exercise. So you can breathe in through your nose and hold it for 3 or 5 seconds this way, and then you blow out through your mouth. You do that and try to take your mind away from all this. This is just a machine. And the numbers, don't freak out on the numbers. The numbers you're gonna get on your first reading doesn't determine your baseline. Like I said, you need to check this at least for 7 days, morning, night, write on your reading, and then you look at the range of the number and pick the one that appears more often as your number, okay? And the doctor is not going to prescribe you medication right away. They're going to look at all the health risk factors that you may have. Maybe if you have cholesterol issue, maybe if you have diabetes, maybe if you're overweight. You know, they're going to look at all that before they put you on a blood pressure medication. Believe me, once you go and they see you have, say, a stage 1, they might not put you on a blood pressure medication immediately. Okay, they'll want you to go try out some lifestyle modification, like your diet, like exercise, diet most of the time, activity, exercise, and then you come back, say, in 4 weeks. If it's still elevated, if it's still maybe stage 1, then they'll put you on a blood pressure medication, but you have a huge part to play. You get this? Monitor your levels. Monitor. You might be wondering, why should I get this and start now? A majority of people are not eating healthy. A lot of stuff, like I said, is going on in the arteries. So take charge of your health. Be your own advocate. You know, when you know all this and you stepping into your doctor's office and they're speaking or saying to you, you have more confidence and you're not freaking out. What are they saying? At least you know, this is where I need to work on. So get this, put on your readings. It can be once every week. That way you know when you're going out of track, and then do something about it, okay? So enough of this. So I think I'm going to check my blood pressure now. And okay, guys, I didn't want to talk because talking will affect the reading. So I have 115/68, and pulse is 72. All right, so normal blood pressure usually is 120 below, 120/80. Okay, so anything below 120 above, and then below number, anything below 80. Okay, 80 and below. That's okay. Let me make it easy. So the top one, I have 115/62 heart rate, which is your pulse is 72. All right. So for blood pressure, for you to accurately say someone is hypertensive, you cannot base it on this reading. You cannot just look at this number and say I am not hypertensive. What I need to do is take my reading, or you take your reading morning and night for at least 7 days, then you go share it with your primary care provider. That way they'll take an average and tell you where you are, okay? Or tell you if you're hypertensive or not, okay? So for this, let's say this is my first reading, right? So the top one is 115, that's normal. The bottom one is 68. That's normal. Then this third number here is a heart rate, usually 60 to 100. Mine is 72, normal, right? So when you say someone has elevated blood pressure, it means the top one is between 120 and 129, and the bottom one is normal. Okay, when you say someone has stage 1 hypertension, stage 1 blood pressure or hypertension, it means that the top one is 130 to 139, or the bottom one is 80 to 89 for stage 1. For stage 2, it means the top one is 140 and above, or the bottom one is 90 and above. I think it just went out. I think I can get the memory. Yeah, so that's, so when you say someone has stage elevated, let me repeat that. It means the top one, all right, is 120 to 129, but the bottom one is normal, which is 80 and below. When you say someone has stage 1 high blood pressure, it means that the top one is 130 to 139, or the bottom one is 80 to 89. When you say someone has stage 2, it means the top one is above 140 and above, or the bottom one is above 90. And when you say someone has hypertensive emergency, it means that the top one is 180 and above, and the bottom one is above, or the bottom one is above 110, 120. That's an hypertensive emergency. So for that case, you need to seek immediate medical attention. With that number, a person can have a stroke. Okay, so like I said, numbers, don't freak out with numbers. How you can tell, take your numbers morning and night for 7 days and put down those readings, review that with your primary care provider. And also know that this top one, the top one here, which is the systolic, can be affected by a lot of things. Like if I was talking, it might go up. If this was too tight, it can go up. If I just had coffee before checking my blood pressure, it's gonna go up. If I just had a very vigorous exercise, my heart rate is gonna go up. The top number also might go up. So if I'm just eating, the top one might go up. So a lot of things can affect, even weather, the environment, stress can affect the top one. So that's why I got cut off, and I'm doing this alone. I'm doing this video alone, okay? So I was talking about how your blood pressure, the top one, can be affected by weather, stress, heat, cold. A very hot environment, a very cold environment can affect the systolic, the top reading of your blood pressure. So that's why it's very important. If you want to check it, if you want to know what your blood pressure, the accurate blood pressure reading, get this and have it at home. Check it in the comfort of your home, okay? Morning and night for 7 days, just to know what your baseline. Doesn't mean you should do it twice all the time forever. Like for you to know your baseline, at least 7 days, morning and night, write it down and just look at the number that appears more often. That is your baseline, okay? And your doctor or your primary care provider can also interpret that for you, okay? And then that doesn't mean you're gonna go on medication right away. You can start taking care of like what you eat, if it's exercise, a lot of things that you can change before even your doctor will decide if they'll put you on a blood pressure medication. A lot of things that can be done before you start medication, and your primary care doctor will be looking at other risk factors, like if you're obese, like if you have cholesterol issues, your diet. They'll work with you on other factors just to make sure that your blood pressure is not uncontrolled, okay? So when it becomes uncontrolled, or they see that your lifestyle modification is not helping, then they'll put you on a medication. But good, be an advocate of your health first. Be able to know what you find out these things by yourself before you go to your doctor. Start now checking your blood pressure, writing it down, taking care of your lifestyle behavior, and you'll be fine. Okay, so if you have any question, please make sure you're asking that at the bottom. Okay, and I hope you enjoy the rest of your day, and I'm gonna do another video about blood glucose. I see I get a lot of questions about blood glucose, how to control blood glucose. Some people are already diabetic. I want to know how to, bring down their A1C or their number. Some people are pre-diabetic. I want to know how they go back to being normal. So I needed to watch that video. It should come up after this or before this one. Okay, so do enjoy the rest of your day and stay blessed. Bye bye.